Hello there. Welcome. Meet Gideon Danso, a remarkable individual with an impressive academic journey. His dedication and passion have earned him a prestigious £5,000 scholarship through the AmberScholar program. Gideon's outstanding achievements, commitment to education, and vision for the future exemplify the values of AmberScholar. So, let's get to know our star student a little better, shall we? Over to you, Mansi.
Thank you, Shloka. First of all, Gideon, a very hearty congratulations on being the first winner of Amber Scholarship. And we could not be more glad to have such an inspiring candidate become the first winner of the prestigious scholarship that we are introducing in the industry.
I am so honored. I am so privileged to be the winner. Words can't describe how I am feeling. Thank you very much for the organizers of this amazing program. I am forever indebted in you guys. Thank you very much.
So, Gideon, just so our audience knows you a little better, can you let us know about your background and what inspired you to pursue higher education, especially as a health information officer?
I was born and raised in a small town in Ghana called Konongo. Well, my background story is one for the books, and my journey is a tale of personal, emotional, and educational growth. I faced adversity early on, being the eldest son to my siblings. It dawned on me an unexpected expectation. I am like a role model to them. I am like a trailblazer and to my parents. So I know I can't afford to mess up. So I persevered. I take up responsibilities that push me beyond my comfort zone. Every sunrise brings new lessons. Every day brings new opportunities. And I've always thought to help others. And I thought once I have a degree in medicine, I will be able to understand the pain of others and help assist humanities in terms of their health. But life has its twists and turns, and only after taking a turn, you would see what's around the corner. I've always thought of being a health worker, honestly. So after my high school education in 2016, I sat down to write the medical student entrance exam. I passed and was offered an admission. But the amount of money that was supposed to be paid as the school's fees was hefty, honestly, and my parents couldn't afford it. But I totally understood them because I knew their financial strength. Moreover, I was not the only child they were taking care of, so I lost the chance to study medicine. Well, I felt depressed for almost a month. It felt like my world was crashing down. But almost after a year after losing that admission, on that fateful day, 7th October 2017, Ghana witnessed a catastrophe that's etched into the memories of many people. There was an offloading petrol tanker located at the state-owned an oil company, and it caught fire, resulting in a large-scale explosion at the site of a liquefied natural gas station located at Atomic Junction in Medina, Accra, Ghana. That disaster left many Ghanaians lifeless, whilst also sustained the varying degrees of burns and injuries, resulting in permanent physical disabilities. That day up till now is marked a black day in the history of Ghana. But throughout this disaster journey, one person stood out as a hero, a champion. His name is Dr. Anefi Asamoah, a celebrated Ghanaian public health practitioner. Like his outstanding contribution to the betterment and disaster prevention and relief in Ghana is highly recognized. He was even awarded by World Health Organization, the regional office for Africa. I love this man to bits. I drew inspiration from him. I saw myself in him. So how he fought tooth and nail to bring out the cause of the explosion, how he came to the aid of the victims, how he sympathized with the bereaved families, how he came to he gathered information about the appropriate statistics of the victims, how he educated the public about first aid should in case fire or scarred cases arise again, how he puts out measures to ensure that such calamity never happens again. They were laudable. So it was the magic I had been waiting for, because he indirectly educated and informed me about the beauty of public health and how it works to bring comfort and good health to humanity. Well, I did my research and realized there is a program in a Ghanaian university having public health embedded into it, health information management. Well, I bought the admission and got accepted. But since I've been always passionate about health, I read about becoming a health information officer and realized it was a perfect fit for me. I loved the idea of using data to improve patients' care and make healthcare more efficient. And plus, I enjoyed the challenge of staying up to date with latest advancements in the world. Yeah.
Definitely, Gideon, I would say that is a very inspiring story, and I'm sure you're inspired by it as well, and that's why you are where you are today. Definitely, one question I have for you, as somebody from Ghana, how important do you think, it is for public health practitioners and services to develop?
Okay, this topic, it's quite dicey. It's delicate for me. It's delicate for me. I might get emotional along the way, because the public health practitioners and the services they provide in Ghana, they are not the best. Honestly, they are not the best. I think there is more room for improvement. I've had the chance to work in a hospital, and that has allowed me that it has allowed me to see real physicians in action. I see how they take patients' vitals, how they monitor them, and how they prescribe medications to them. But unfortunately, I'm very disappointed with um, how public health is not effectively being used by these people. Doctors spend half, if not most of their time giving medication to these clients, visiting the hospital, but they have little or no time to educate them on preventive measures for the ailments they bring to the hospital. So these patients will get readmitted to the hospital again, like 3 or 4 weeks later, because they don't adhere to the preventive measures. But with recent changes and advancements in healthcare delivery, healthcare consumers have become increasingly interested in accessing quality care. But despite all the efforts by the Ghana Health Service, the Ministry of Health, the central government, the donor funding agencies, and other stakeholders to improve quality healthcare delivery and institute health reforms, challenges such as maternal health, poor hygiene, sanitation, mental health issues, women health problems, they are still weighing down these efforts. My country, Ghana, like any other developing country, has several unaddressed public health problems, and that pose serious risk to the Ghanaian population. Malaria, chickenpox, cholera, tuberculosis, they are on the rise in Ghana. Diseases of public health importance, leprosy, yaws, schistosomiasis, onchocerciasis, they are all on increase in Ghana. Communicable diseases are prevalent. There is also an increase in non-communicable diseases, cardiovascular diseases, chronic respiratory diseases, diabetes. They are all another topic for another day. Do you know that a research came out and it was like a typical Ghanaian is estimated to die from a lifestyle or public health disease? Why? Women health problems in Ghana are related to nutrition, public or reproductive health, but they are not treated with utmost care. Why should someone die giving life to another person? Maternal and infant mortality, they are worsening in the past few years. Suicide rate in Ghana is skyrocketing, and it's common among young adults and adolescents like myself, because mental health is not taken seriously here. As of July 2023, there were 48 deaths out of 614 attempted suicide in Ghana. Why? What is the Ghana public health practitioners doing about mental health? How can we protect ourselves from and others from suicidal tendencies? But it sounds like a government problem too somehow. But expenditure towards health resources has increased in the last 2 decades to improve public health. Yet much still needs to be done about it. The hospitals and emergency services available in Ghana do not meet the Western standard. It's obvious. But the Ghanaian government has increased expenditure for availability of better healthcare resources and infrastructure. The government has also set up NHIS, that's the National Health Insurance Scheme, a health coverage for Ghanaian population, which is responsible for decrease in death and infections. So this scheme is available to low-income employees with flexible premium rates. Anti-malarial, antiviral, and other medicine to reduce risk and infections are available throughout the country, yet the otherwise is happening, increase in infections. These are all clear indicators that public health practitioners need to develop the services they provide to the population. Well, if you ask me, what then do they need to do? How are they going to develop their skills? I think their key target area should be prevention. They should focus and place strong emphasis on the prevention aspects of a disease rather than curation aspects. What is causing a particular disease? The source and how to eradicate it. They can do this through community engagement by creating awareness, public education. The public health practitioners in Ghana, from my perspective, need to develop themselves and provide services that promote healthy lifestyles, such as strengthening public health surveillance for prevention and control of all events in the hospital, facilitating screening services for communicable and non-communicable diseases, ensuring protection of public health and safety. They can provide immunization and child welfare services. I think one thing most Ghanaian public health practitioners need to develop on is bridging the gap between public health and clinical care service. They should bear in mind that the data collected from them, they generate timely response to prioritize health events and health needs. So if they do this, then morbidity and mortality due to health associated infections will reduce in Ghana. I think public health practitioners need to note that the services they provide are a backbone to the development of every nation, with Ghana included. From keeping communities healthy, preventing and addressing pandemics, spearheading disaster relief, ensuring access to healthcare, and so much more. Public health professionals and the services they provide cannot be underrated. And I believe it is incredibly important for public health practitioners and the services they provide, to develop. By improving public health initiative, we can enhance the well-being of our communities. By this include promoting preventive measures, implementing effective healthcare strategies, and addressing specific health needs of the population. Developing public health services can lead to a better healthcare outcomes and a healthier society for all. I believe together, public health practitioners can work towards a healthier Ghana. Yes.
Definitely, Gideon. I do agree with you. Research and experience, and when it comes to the services, they definitely need to go hand in hand. While we've heard a lot about a lot of research that you've done and a lot of studies that you've read. We also, through your SOP, we got to know that you interned with Cape Coast Teaching Hospital, right, in Ghana, and also with the Konongo Odumasi Government Hospital. Can you tell us a little more about your experience there and what you've learned with that entire journey?
First of all, I have to applaud you for the perfect pronunciation of the name. That is exactly how it is pronounced. So well done for that. Yeah, I was privileged to intern with one of the 5 teaching hospitals in Ghana, the Cape Coast Teaching Hospital. So the Cape Coast Teaching Hospital is the biggest hospital in the central region of Ghana. Ghana is divided into regions, as some countries, states, provinces. Ours is regions. So we have the central region in Ghana. So that is where the hospital is located. And the hospital provides different kind of health services to the people of the Cape Coast metropolis. And I also intern with Konongo Odumasi Government Hospital. So Konongo is my hometown, and it's a government hospital located on the Konongo High Street. And my hometown, the Konongo, is in Asante Achim district. That's in the Ashanti region of Ghana. The hospital is National Health Insurance Scheme accredited. They accept it and they offer general services to the population. So during my time of internship, the hospital was operating on the hybrid type of electronic health records management. That is, they were using both paper and electronic devices, and they were transitioning to a fully automated electronic health records using the big bang type of EHR implementation. The reason why I embarked on the internship was because I wanted to obtain practical experience in my field of study, and also I abreast myself of the work environment. During my internship, my main duty was to assist the health information officers of the two hospitals with the implementation of departmental goals, and that included various tasks depending on the daily activities. I was assigned quite a number of tasks, but prominent among my roles and responsibilities at the two hospitals were using of this two capture data app. This is DHIS. So it's an acronym for District Health Information Software version 2. It's a free and open source health management data platform that's used by multiple organizations and hospitals in Ghana. And basically it's a tool or an app used to collect, validate, and analyze patient-based statistical data. And so once I was introduced to this app, I knew the overview of this app because that was the app the hospital was using. I started entering data from the medical certificate of course of death register into the app. So basically the medical certificate of course of death register, it's like a book, a big book, and it helps the health information officer to classify the manner of death of a patient, whether the person died through a disease, whether it was an accident, an assault, war, even if the disease or even if the cause of death can be determined, if it's unknown, if it's impending investigation. Yeah, so the reason why we do all this is to help with the compilation of the monthly mortality rates. And one thing is, most people interchanged death certificates with medical certificates cause of death. They use it interchangeably, but they are not the same. So I learned that during my internship. And I also was entering data from the delivery register. You know, delivery register is of great importance in every hospital because it explores the expectation of a pregnant woman relating to their labor and their delivery needs. So I made sure I understood everything in the delivery register, the variables and everything used in them. And I also used an app. It was an app to trace the patient satisfaction of the hospital. It's called ODK Collect app. So ODK is also an acronym for Open Data Kit. So it's an open source Android app, and it's used to replace paper forms. So and it's used for survey-based data gathering. So during my internship, I used it. So after care is given to a patient, I'll move to the patient and ask, were you treated nicely? Are you satisfied with the service you are given? I ask them questions like that to improve upon the care, to make changes in the hospital. But one thing is the anonymity of the patient is protected so that they can give their honest answers. So no identifiers such as the patient's name, the patient's residential address, the patient's age, anything that can identify the patient's picture, they are not collected. So I use that app to collect a wide range of question and answer type of data. And I also learned how to design the app myself. So I also learned so there were actually two ways to design the app. You can use an already built platform called the ODK build, where you just drag and drop your question and the app will automatically develop the form for you. But I learned how to do it from scratch, and we use the Microsoft Excel to develop the app. So I did it, I learned how to do it, and I also learned some of the variables used, the properties used in developing the app, like the data name, caption text, the hints, default value, read only, required fields, etc. But at the Cape Coast Teaching Hospital, I learned about medical records management, disease surveillance activities and determination of health facility indicators, diagnosing and managing diseases of specific importance to public health. I learned about immunization, cold chain management, computer application, health system. The list goes on and on and on. But overall, my internships experience an eye-opener, and I expressed my deepest appreciation to all those who provided me with the opportunity and guidance. The internships came with many lessons I learned with a happy heart and an open mind. I had a better understanding of delivery register, ODK forms, medical certificates, of course, of death. I also developed strong computing skills because I was always utilizing Microsoft Excel, PowerPoint, and Word. I had the chance to hone my skills. I also had the chance to work with different people in achieving the goals of the organization and my department. So somehow I developed a spirit of teamwork. I became a great team player. I've also developed excellent verbal and written communication skills, strong organizational and time management skills. All these I learned through my internship. The internship, it aided me to have an in-depth knowledge about records and health information management in the healthcare world. Konongo Mass Government Hospital offered me the opportunities to learn and develop myself in many areas. My internship at Cape Coast Teaching Hospital prepared me to be ready to serve the needs of health care industry more effectively by providing me with the real life experience and exposures, granting me the opportunity to learn more about my self potentials and abilities, getting connected and developing professional network. I gained a lot of experience, and my internship at Cape Coast Teaching Hospital and Konongo Mass Government Hospital were definitely an introduction to the actual work field.
Definitely, it was great to hear, Gideon, on how the health service sector in Ghana itself is expanding. Getting apps introduced to make sure all the patients and everybody is very free to give out information and everything is secure. While I heard all of that, I also am in awe of all the research that you have done personally and the learnings you've had so far. Right, when it comes to research methods, public health, project management, I think you have a great achievement so far till
Yeah,
now, right?
yeah.
I just want to understand how you feel these experiences, is going to contribute with your further studies and, personally and professionally with your growth going forward as well.
Okay, I think during my undergraduate course, I studied courses like, as you said, research methods, public health, project management. Um, my end goal is to become a health information officer or a public health practitioner equipped with the needed technical and professional expertise, wishing to focus on a career in research, data analysis, and other related concepts development, where application of statistics, skills, unique abilities, and experience will be put into effective use. Well, I've gained a broad knowledge that is yet to be enhanced to enable me reach my end goals. Under HIPAA Privacy Rule, the Health Insurance Portability and Accountability Act, and Common Rule, research is defined as a systematic investigation, including research development, testing, and evaluation designed to develop or contribute to generate knowledge. This is a broad definition that may include biomedical research, epidemiological studies, and health service research, as well as studies of behavioral or social and economic factors that affect health. An increasingly large portion of health research is now information-based, and research is also information-based. So a great deal of research entails the analysis of the data and the biological sample that were initially, collected for diagnostic, for treatment, and billing purposes. Having prior knowledge in research methods will help me as a potential public health practitioner in fields such as epidemiology, health service research, public health research, and it includes analysis of the patterns of occurrence, determinants and natural history of diseases, drug safety surveillance, etc. Like quality healthcare services. Having experience and research method in health has high value to society. That can help me with my end goals by providing me with important information about disease trends and risk factors, outcomes of treatments, public health interventions, pattern of care. And you also know that experience can be a powerful tool for engaging your community. So also having an experience in public health, it can play a critical role in my reaching and in me reaching my end goals. Promotion of health, prevention of diseases, and empowerment of individuals to illness and disability. Every new scientific finding has the potential to positively impact the lives of million people. As As humans' behavior evolves, so too will the need for public health practitioners to have prior public health experience. Public health practitioners, we are problem solvers that routinely find solutions to enjoy challenges associated with fighting diseases and developing prevention programs. So the ability to identify health risk and then initiate a plan to resolve them, they requires a public health experience. The use of data along with ethical consideration to make plans in resolving a public health issue requires a public health experience. So having experience in public health is a rewarding benefit, and it will enable me attain my end goals because I will be making a lasting impression to improve my society. Also, I have experience in project management. Yeah, I have experience in project management too. So project management in healthcare is basically about planning and executing projects to improve the functionality of the healthcare organizations. So to achieve the goals of saving costs, improving the quality of care, eradicating or predicting resource requirements, healthcare services, facilities, and hospitals. We continually design and implement projects to improve the operational efficiency. So me having an experience in project management is important due to the stringent safety requirements for healthcare buildings, complex electronic health record systems, and regulation for equipment and processes. You know, having experience in project management will help you with which projects needs to be on top of the priority list, which projects needs much allocation of funds, which projects need to be abandoned, which projects needs to be done quickly, which projects need to be ditched, and which projects need not to be tackled at all. Having an experience in project management, it has enhanced my communication among stakeholders, productivity, resource allocation, and I can say my experience in public project management, it has equipped me with efficient problem solving skills. I can identify and resolve issues when working on a project. These abilities has allowed me to remain calm even when unforeseen circumstances emerge, like there is a reduction in organizational budgets. I am not perturbed because I can take the project on hand, do investigation, and know what is causing the reduction in the budgets due to how I was taught in project management. When there is a defect in a medical instrument, I will know that hey, we are embarking on this project, but we can use funds from this project to repair or mend this instrument, because if we do it with these projects, because my knowledge in project management will teach me that this is not going to end well, because this project is on top of the priority list, so it should not be touched. Funds from that area should not be touched. So I can use my experience in public management to determine the source of an issue and guide my team members in handling specific situations.
So, are there any things that you're especially excited about? Maybe some part of the course, or maybe the life in UK?
Everything about I'm excited about everything about public health, but the epidemiological aspect of it, it's a branch of public health that we study the spread of diseases, infections throughout the population. So it's more about statistics. I love the mathematical aspects of public health. Some of the challenges include higher academic expectations, adapting to a new academic environment, managing time efficiently, dealing with academic pressure, balancing personal and academic life. But I'm glad I found ways to resolve all these challenges. I overcame them by seeking support from academic departments, mentors, and fellow students. I also did some myself. I established time management plan. I developed study habits. I attended workshop and seminars. I prioritized tasks. I set realistic goals, and I asked for feedback to improve my performance. But there was one profound challenge that every solution I invented, it did not work for me, and that was financial constraints. I come from a family that, in terms of finances, is not doing so well. But I'm forever grateful that they somehow magically pushed me through my undergraduate studies. My weekly stipends are so inadequate that I had to resort to doing menial campus jobs that pays very low. and I can't afford a white collar job that pays hefty salaries because of the long work hours and balancing a demanding workload and a higher academic standard. It can be overwhelming. You know, let me tell you a scenario. Imagine learning computer programming without your personal computer or laptop. So I had to use the university provided computers in the libraries, and the distance I had to commute from my hostel to the library every day is a topic for another day. Budgeting, obviously, you say, why don't you budget? Budgeting, it was not working for me because every money I get, it was for hand to mouth purpose. And grants, scholarships, and loans, they do exist, but the process is untrustworthy. It is noted for nepotism and favoritism, and it's a cumbersome and complex process. Moreover, the interest rates on students' loans are outrageous. I can't risk it. And so I'm always at the crossroads. My mental health is always at stake because I'm always looking for a way to solve this challenge. Several times I was on the verge of quitting. Yeah, but somehow I was resilient and um, I was resilient. I wouldn't come this far to quit, to give up. I remained determined and focused and maintained a positive mindset. You know, my journey has been full of not so proud moments. Maybe that is why I understand the pain of others. I believe not everyone is as strong as me to withstand or endure this unbearable trauma. Yeah, like I work, but I wish to focus a lot of time on my studies, and this scholarship will help me by lowering the cost of my tuition and having to pay back people who helped, who sponsored me. I am in debt with them. I have to pay for them their debt loans so I can use it to pay them. Or this scholarship will even reduce the amount of hours I would need to work throughout my studies. This way, I'll be able to continue with my academic journey with ease. I will be able to achieve my academic goals. This scholarship is a lifesaver, if you ask me.
And we really hope that this scholarship helps you overcome the challenges that you have been facing and any hiccups that you might face in your education going ahead as well. Going forward, how do you see Amber Scholarship impacting the lives of any future recipients of the scholarship?
Okay, you might not know this, like it might be oblivious to you, but the AmberScholar program, it does not only cover the costs for pursuing higher education, but it changed the life of the person. It changed the lives of the individual. It changed the life of the students, of the person. You know, for future recipients, the Amber Scholar program can impact their lives by reducing the financial burden of the rising cost of tertiary education and allow them to find more time and energy to focus on their studies rather than taking on part-time jobs. The Amber Scholar program, it will impact the lives of the future recipients in different areas and dimensions, financially, career-wise, educational impact, employment impact, personality impact. It goes on and on. Financial impact, you know, many students graduate from college with a normal student loan, debts, and they even have to limit their education in an attempt to cut or control costs. Since the AmberScholar program, it does not have a payback model, the current and future recipients can focus on their education instead of thinking of how they will have to repay loans. And by removing these financial barriers, the Amber Scholar program, it will impact the lives of the future recipients by allowing them to achieve their career and educational goals with ease. They don't have to think about a loan. They don't have to divert their attention about how they're going to control this cost. So if they get a scholarship, you are impacting their lives. You're making them achieve their goals, their educational goals with ease. And also educational impacts. You know, having a scholarship like Amber scholarship program, it pays for education, and you can it can actually reduce the financial recipients dropping out and not getting the degree they want. They may even be able to consider a more selective institution or a major. So by reducing the financial concerns, the Amber Scholar program, it will impact the time management for studying and learning for the future recipients. And also, the scholarship will be making career impact on the future recipients. Earning a prestigious scholarship can make a recipient a better job candidate. Employees who understand the competitive nature of a scholarship, like AmberScholar program, they will recognize it as an accomplishment for the recipients. So they have a heads up when they're applying for a job, because you are a valuable asset. You were able to win in a competitive race. So you get what I'm trying to say. And also they have an employment impact, for future recipients. Translating that CV into an employment resume is the end goal of your education. And having a program like that of Amber Scholarship on your resume, it can make a big difference for your potential employer. Personality impact, you are making impacts on the lives of the future recipients. Amber Scholar program, you can have impact on the future recipients by making a big difference in how much time and resource they will have in the educational journey, and how much they are going to spend on the experience and knowledge through service learning. They will get the chance to volunteer for opportunities, to intern more. On a more personal level, the Amber Scholar program can reinforce self-confidence and give you greater power of resilience. Amber Scholar program is a concrete way of demonstrating that you're a valuable commodity. So if you do not succeed this time, you are likely to succeed in the future. If you ask me overall, I would say Amber Scholar will impact the lives of current and future recipients by making the academic journey more accessible and affordable, and paving the way for them to be successful in the pursuit and completion of their degrees. And when recipients can successfully earn their degrees, and the process is not burdensome or postponed, our greater society and economy are benefited. Yeah.
Well, I'm sure, Gideon, all of our viewers are very excited because we still have scholarship running for the January intake. And they
Okay.
definitely have heard from you on what are the, pros on, winning an Amber scholarship with us.
Okay.
I'm sure they would
Okay.
also want to understand what was your secret, and what helped you in winning the scholarship.
Oh, okay. Well, I wouldn't call it a secret, because I wouldn't share my secrets with anyone. I would call it tips. I will barely share my secret with no one. I call them tips. So these are my tips. My first tip was I prepared in advance. So when I chanced upon Amber Scholarship, I read more about it, realized I was eligible to apply. Then, I gathered my documents. There is a saying that if you fail to prepare, then prepare to fail. So since Amber Scholar comes with so much competition, I prepared myself adequately for whatever the program is willing to offer. I prepared myself for things like this, the interview. I proofread all my essays to make sure that they are free from grammatical errors. You know what I'm trying to say? So you don't have to rush things. Take your time. Once you chance upon it, read out, read wide, know what they are all about. And when the time is due, you just submit it, because this time you have more time to apply, you have more time to submit your document. So you will get time. If they require a document that you don't have it presently, if you prepare in advance, you can get it before the deadline hits you. So my first tip was I prepared in advance. And my second tip was I put out my exceptional qualities. Yeah. So to beat a program like Amber Scholarship, it was the best that I stood out from the thousands of applicants by investing in self-development endeavors. And such endeavors include volunteering your time to learn various skills, various knowledge, extracurricular activities, leadership skills. You should intend more, things that will likely clothe you with some exceptional qualities that will make you stand out, that will make you the best, the creme de la creme, make you, the pick of the litter, the favorites of the favorites. So you should put out your exceptional qualities. It's a chance to sell yourself. So yeah, I did that and it worked for me. And also my third tip was being my real self. The bitter truth, which I will emphasize here again and again, is that scholarships, they are quite competitive. That means a candidate who do not meet the necessary requirements won't be considered. That's a fact. So the best thing I did for myself is to try as much as possible to present myself um, uh, in my real self. Yes, and if you do that, it's the best. It's not necessary to lie. It's not necessary to tell a fib here. Tell them you are this, then truly you're not. It's not because if you do that, you even end up mixing up things. You know, your cover letter won't tally with your academic performance. You know, your CV won't tally with even your years you completed school won't tally with your CV because you're lying. You are not being your real self. And it might be worrisome to, present yourself as a leader, having some leadership qualities in your documents, but you lack composure at interviews. It will make no sense. And my other tip was, pray. I am a Christian, I am religious. So after applying for the scholarship, I backed my application with prayers. I pushed it with a spiritual force. So if you're religious like me, after application, you can also pray to your supreme being. You can communicate to your being of worship that, hey, this is what I have done. So back me with a power, back me with a spiritual force. And if you're not religious, you can also hope for the best. You can also hope that may the odds forever be in your favor. And my last tip is it's one of the most important. I saved the best for the last, is to stick to the application instructions. Stick to it. I believe most applicants who do not win scholarships for which they applied for is because they do not stick to instructions. Submit the word in PDF format. Do it in that format. Submit it in Word format. Submit it in Word format. Send a picture in this format. Do it. Your essay should not exceed this limit. It should not exceed. They have a reason why they are giving you that instruction. So why are you not having the same reason to stick to that instruction? You should read in between the lines. You should understand every step outlined and follow the same to submit your application. So before you hit on the submit button, make sure that you have submitted all your documents in the required formats, in the required field. Try as much as possible to keep your essays brief, concise, and straight to the point, so you don't exceed the word limits. And also apply early enough so you don't do a hasty submission when the deadline is inching closer. And if you feel you need some clarification or clarity on some instructions, send a mail or text to the providers for clarification. You don't need to assume. You don't have to guess. They are always there to help. Send them email. Send them for more clarification. You don't have to sit down and say, okay, well, I guess this, so I'm going to do it that way. No, they are there to help. Send them a mail. Send them a text. Hello, please, I don't understand this. Hello, you know. And my message for the future applicants is that they should never give up. Trust me, applying for scholarship is a daunting task, but it's worth all the stress. And but if you fail in this edition, don't worry, the next edition will come. By doing this, you are not applying from scratch, but this time you're applying from experience. So gather your documents and be the first to apply when the next edition starts. Because being a number scholar, it's totally worth the hype. Just look at me. I am the first edition's winner. It's an achievement, it's an accomplishment. It's worth the hype. Yeah. But before I end, I am grateful to be receiving this generous support from AmberScholar program. And if you want to know, the world stood still for me to read that email I received on 25th September 2023 at exactly 1:54 p.m. I was overjoyed and couldn't help smiling. And as an individual from a low income household, I can attest that financial limitations can present a huge barrier to higher educational attainments. And I am so thankful. I am thankful that I am granted this scholarship. The process was quite straightforward and easy to complete, honestly. An scholarship, you really do support the students in need and at the right timing too. Best way to practically end the year 2023. Words can describe how grateful I am to the entire team at AmberScholar Scholarship. Um, I truly appreciate every one of you, and I pray for continuous success in all you do. And you have changed my life. You have changed my life from good to great, and I am forever indebted in you guys. I owe you guys one, so thank you.
Thank you, Gideon. I think it's the applicants that make the entire scholarship program, fruitful at the end of the day. And we were definitely very happy to cater to all the applicants that we got. And, choosing best three out of that was definitely a task, but a one that we enjoyed along the entire journey. Uh, while we did understand how Amber Scholarship worked for you and, how grateful you are of Amber, to have that opportunity out there, we're also inspired by your entire journey, your entire background. It's not an easy task to move from one country to another, just to pursue your dreams and do something more. And I think that's a biggest message that you have given our viewers today, where pushing the bounds, pushing the boundaries for yourself, having faith to reach there and do it is something we all should learn from you. While we had all of these inspiring words from you today, and we are definitely happy to have you on board for the first cohort of
I am more than happy to have you. I enjoyed every bit of this interview. I enjoyed every bit of it.
We definitely enjoyed speaking to you as well, and I would once again like to congratulate you, Gideon, on winning the scholarship and being a part of this entire journey with us. I would like to hand it over back to Shloka. She has a few words for our viewers as well. But once again, congratulations.
Thank you very much. I really appreciate it.
So, to our viewers, Gideon Danso's story is a shining example of the transformative power of education and the impact of the Amber Scholar program. As we celebrate Gideon's achievements, we also look forward for the upcoming second edition of Amber Scholar, where more bright minds like Gideon will have the opportunity to fulfill their dreams and create a positive change. We invite all aspiring scholars to join us and stay tuned for updates on the Amber Scholar program's second edition, which is now live until the 31st December 2023. And the winners will be announced on the 31st of January 2024. And the best part, the first edition was only for UK, but the second edition will include Australia too. So don't wait another moment, apply right now. Thank you, Gideon.
Thank you very much.
Thank you so much, Gideon. I think that's it from our end. We were very happy, that you were able to join us today. And I wish you the best of luck for the rest of your journey with, Brunel University and your journey in London. I'm sure it's going to be a whole new experience for you.
Thank you very much. I appreciate it. And I appreciate your time too.
Thank you. You take care.
Take care too.